guys, Bear here from GSD Bear. Welcome back to the channel. Today's video is going to be answering some of the most frequently asked questions that we receive on Bear's Instagram. So hopefully if you come here with a certain question in mind, we'll be able to answer it over the next couple of minutes for you. So probably one of the most frequently asked questions we receive is about the symptoms that we associate with hip dysplasia and what Bears with. And this varies hugely depending on your dog. Some of them might not show any clinical symptoms at all, and some of them might only show a couple of these, if any. So one of them is bunny hopping, which is where they run along and their two hind legs sort of hang together in one position rather than landing independently of each other. And that's not something that all dogs have, and even if they do have it, it may not be that they have hip dysplasia. We've got a dog who doesn't have it and he does run like that sometimes. It's just how he is. A big one for Bear was that he would have difficulty getting up from lying down or lying down from standing. He would always sort of groan when he did that. Not wanting to exercise is another one, so they might seem to be a little bit lethargic and just not as energetic as a normal puppy might be. Or after exercise they might seem more tired than you would expect. Weakness of the hind muscles, so you might notice that they're really quite bony on the back end like Bear was. Because maybe if they're bunny hopping, they're not putting so much effort into exercising both of their limbs independently, so they can lose a little bit of muscle mass. So that's something to look out for. Stiffness, so after exercise they might seem to be a little bit sluggish and not quite right on their back legs. Pain is another one, so they might not like to be touched around their hip area. Bear wasn't too bad with this. You could stroke him and he would be fine, but he would sort of like watch you whilst you were doing it as if something wasn't quite right there. With Bear, sometimes when he was sitting down, so if I was trying to train him to sit in the position, I might guide him with my hand, and whilst I was doing that I could feel clicking in his hip joint. He was also just really clumsy as a puppy and he seemed really wobbly on his back legs, so that's something that I would recommend you looking out for. How to avoid hip dysplasia. So to be able to avoid it, you need to understand what causes it, and there's quite a bit of conflicting information about this online. A quick Google search will tell you that excessive exercise as a puppy, giving them the wrong diet and then being overweight can actually cause it. However, many others will argue that whilst these are factors that definitely don't help their joints, they don't actually cause it, and it's because it's a genetic condition. So if a puppy has inherited the genes that make them predisposed to having it, that's that. What I can tell you from my experience is this. Bear was showing symptoms when he was between 3 and 4 months old, and that was just weeks after we brought him home and he seemed absolutely fine. At that point he was on the very best dog food and we were super careful not to over-exercise him. Despite this, he was diagnosed with severe hip dysplasia just a couple of weeks after. We also know of at least 2 other dogs from the same litter as Bear that have got hip dysplasia. So that says to me that that's due to the parents' genetics. And that's something that our vet agrees with. That's why it's so important to only breed from health-tested dogs. And even though a lot of breeders now are working to eliminate it from their lines, it's just not a quick fix. When did you first notice Bear having symptoms of hip dysplasia? So probably between 3 and 4 months old, he started showing the symptoms that I described at the beginning of this video. By 6 months old, they were even more obvious than they were at 3 months. So the symptoms just got progressively worse and seemed to affect him more as he aged. Is hip dysplasia hereditary? Yes, it is. So if your puppy's parents or their grandparents have had hip dysplasia somewhere along the line, or even just not perfect hips, then there is a likelihood, quite a strong likelihood, that your puppy is going to have a weakness there. How to treat it. So this really depends on the age of your dog and the severity of their condition. If it's really mild and the dog isn't really showing any clinical symptoms, then there's non-surgical management. Stuff like limited exercise, weight management, physiotherapy, hydrotherapy, anti-inflammatories, painkillers. They're all things that can manage their condition, although the problem with hip dysplasia is that it tends to lead to other problems later in life. They're more likely to get arthritis and osteoarthritis if it goes untreated. Usually it progresses to become more painful as the years go on because the hips deteriorate over time, so that's definitely something to keep an eye on. For young dogs, if the hip dysplasia is severe like Bear's, then there are several surgical options that you can go for. One of these is called juvenile pubic symphysiodesis. So this is a simpler and less invasive surgery than some of the others I'm going to talk about, and it's used to treat early stage hip dysplasia in dogs that are younger than 5 months old. This surgery targets the growth plate at the end of the pelvis and stops it from growing, so that the hip socket is encouraged to rotate and better fit around the femoral head, so it's got a better fitting ball and socket joint. Another is the femoral head and neck incision. This is where they completely remove the femoral head and neck, which relieves the pain because there's no bone on bone rubbing anymore. This does result in reduced function though, and it does require a lot of physiotherapy afterwards. Another option is a total hip replacement, which is what Bear had. This is where they totally replace the original ball and socket joint with a metal version of that. And then your other option is a triple pelvic osteotomy, where they make 3 cuts around the hip socket so that they can reposition it to better fit the femoral head. Can my puppy grow out of hip dysplasia? Probably not. Most of the time it's just going to progressively get worse. It's something that definitely needs to be monitored and managed with something at least. Untreated cases, they have a tendency to lead to arthritis and osteoarthritis in the future. Did he return to full activity, or are there still things he cannot do? No, he can do whatever he wants now, he's absolutely fine. So after his operation he had 6 weeks of crate rest, and that was really strict. He had to have that, and that was to keep him calm whilst he was healing. Then 6 weeks after that he'd come off the lead, so it's a 12-week process all in all after the hip replacement. But after that he's fine, he's good to go, and now he's a year on. They're totally solid, and you wouldn't know he'd had anything wrong with them. He can jump, he can do anything he wants, and I don't have to worry that he's going to be in pain the next day. I don't have to worry about them dislocating now. He's perfect. How to prepare yourself and your puppy for treatment. So for your puppy, you're probably going to want to look at doing some hydrotherapy sessions beforehand, because this is going to help build up their muscle mass. And that's important going into the surgery, because it's going to give them more to start with. They're going to lose so much afterwards, they're going to need as much as possible going into it. So hydrotherapy for that. Maybe if your puppy isn't already crate trained, start introducing them to that, because they're going to need to be in there for a little while whilst they're recovering. For yourself, I don't know. I would just watch as many videos as possible, try and collect everybody's experiences with this so you know what to expect going into it, so that you haven't got any hidden surprises and you kind of have an idea of what it's going to involve. What is it like going through? Quite difficult. It is a stressful process. It is emotional. It is difficult. You're in it for the long haul. It is almost like a full-time job watching them whilst they're recovering, because it is so easy for them to dislocate it in the first few weeks of recovery. You really have got to be like a hawk on them. You cannot leave them for a moment on their own. So it is very intense. It's going to cost you quite a lot of money, but it is worth it in the end. Is there anything you'd wish you'd known before deciding to have a total hip replacement? Yeah, I think going into it I didn't know how intense the recovery process was going to be. There's also the cost of things when it goes wrong. With Bear, he actually did dislocate his second hip replacement, so we had to have essentially a 3rd hip replacement to correct that, and that was equally as expensive as the initial replacement surgery. It's also really emotional. You've got to consider the emotional side of things, just leaving them with the vet, having them sedated in front of you, and not being able to explain whilst you're doing it to them, because it is confusing for them. They're suddenly in a strange environment, they're not feeling themselves, they're in pain, and they're being taken away by strangers. It is quite difficult to see them going through that. How often did Bear have physio? Well, before he went to have his surgery, he went twice a week for, I think, 2 or 3 months, and that was to help build up the muscles. And then on the other side of the surgery, a couple of weeks later, when he had healed it, had the same again twice a week, and that was just to help build him up again. He also had a couple of physiotherapy sessions. It was more a case of the vet's physiotherapist showing us what we can do at home. So it was sort of getting him to sway and weight bear on his new hip, because he had a tendency to rely on his other hip sometimes, because this new one felt different to him, so we sort of had to encourage him to use it properly. What exercises can help? So other than hydrotherapy, which I definitely am an advocate for, there's some things you can do to help build up the muscle on your own at home. So what you can do is sort of put some obstacles on the floor that'll encourage them to step over them. Not take massive steps, not jumping or anything like that, just to encourage them to lift their leg a little bit higher than they would if they were normally walking. Also, what you can do, if you live near a hill like we do, you can get them to position themselves with their bum facing down the hill, and ask them to sit, and then when they stand from sitting, the momentum of having to push themselves up whilst on a hill incline, that's a bit more of a workout for their hind limb muscles, and that can help build them up. And also some short lead walks, just to encourage them to keep up a level of activity, nothing strenuous, just to keep them, mobile. If you like this video and you found it helpful, please like, comment and subscribe. If you watch this with a certain question in mind, hopefully I've managed to answer that for you, but if I haven't, feel free to leave it in the comments below and I'll address it in a future video. See you next time.